Hey, good morning, everyone. Look, I just want to drop a little common sense out there this morning, and this is concerning the Affordable Health Care Act and the subsidies and how all of this works. So I know a little bit about insurance because in one of my occupations, I also am in the insurance business. So I know a little bit about how it works and how risk is dispersed. So insurance is about the risk and how many people are in the pool. So what do I mean by that? So the broader the pool of the people who are sharing the risk, then the lower the insurance premiums are going to be. Now, how does that apply to the Affordable Health Care Act? Well, if you go back to the beginning, and I know that was a long time ago when President Obama first took office, he ran on the promise of having health care for all, regardless of pre-existing conditions. Now, he had a public option in there, which was a mix between, actually a partnership between public and private insurance, right? So state-run insurance and private insurance. And there was a requirement in there under that public option, which it would have required all 50 states to expand Medicare and expand it to everyone. Had they done that, then that would have greatly expanded that pool. Even with people who had pre-existing conditions, it would have lowered the risk for the insurance companies, and they would have made a ton of money as well. And it would have brought down the premiums for everyone. Well, they couldn't get all of the votes with the public option in the bill, so then they had to remove that public option and basically go with what we have now. And so in order to make it affordable for people, because now you didn't have that expansive pool like you would have had before. States were given the option to opt out. And when they did that, that decreased your pool of people who would have been paying premiums. And you also have a higher risk to the insurance companies because now you have people partaking in the insurance that had pre-existing conditions, thus raising the risk for the insurance companies, and they're going to raise their rates. So I got a list here of states that actually opted out. And most of them, if not all of them, were red states. Alabama, Florida, with all of those elderly people there, who I'm sure a lot of them, or a good portion of them, have healthcare issues. Georgia, Kansas, Mississippi, Wisconsin, and Wyoming. Now, Georgia, I will say they do have, they partially opted out. So there is a cap that they have for you to qualify or not to qualify. So if you are in one of those states that opted out, what does that mean for you? That means that you may make too much to qualify for Medicare or Medicaid, right? I believe it's Medicare. But you also make too much to get subsidies under the Affordable Health Care Act. What are the subsidies? Well, I'm glad you asked. Because that pool shrank with the other states opting out, the government now has had to provide subsidies. Well, those subsidies are based on how much your income is. So if you live in a state, you've got pre-existing conditions, they've opted out, you make too much for Medicare, and you're in a situation where you don't meet the threshold to qualify for subsidies, or you don't qualify for enough subsidies to bring your insurance premiums down to an affordable rate, you're going to end up paying more for that insurance coverage under the Affordable Health Care Act. So that's why you have some people saying, hey, it stinks, it's expensive, it's unaffordable. Well, it's unaffordable. Why? Let's go back to the root again. Your Republican colleagues, a lot of the people that some of you voted for. So they create the problem and then turn around and say that the Affordable Health Care Act is a bad program and they want to get rid of it. At the same time, they don't have a plan themselves. They just want to destroy it and put nothing in place. Now, they said they revealed some sort of a plan. I haven't seen anything. Look, the Republicans had over a decade, actually almost 2 decades, to come up with a plan. They haven't done it yet. You haven't seen anything. They're not going to come up with the plan, folks. Look, if these subsidies go away, your insurance premiums are probably going to double, if not triple in some cases. So what's going to happen? Most people are going to drop that insurance, because if you had to choose between paying your rent or paying health insurance, which one are you going to do? If you got to choose between groceries, your medicine, what are you going to do? And that medicine is going to be a lot more expensive now, especially if you don't have insurance. So remember, insurance is about risk. The more people that are in that pool, the lower the risk is, and the premiums come down. So remember that when you go to vote next time, all of those states, Alabama, Florida, Georgia, Kansas, Mississippi, Wisconsin, Wyoming, remember those states that opted out, they are the real culprits and the reason why your health insurance is higher under the current Affordable Health Care Act as it is today, because they opted out. And on top of that, even before that, they would not get on board with the public option. January, watch out for those rates, folks. Look, I just want to drop a little common sense on you and kind of let you know how these things work. Look, you guys stay prayed up, stay vigilant, and just know that God is still on the throne and everything's going to be okay. He's going to work this thing out. All right, y'all take care. I'm going to hit the button.